This morning on Today's Health, a closer look at concussions and sports. Serious head injuries are common from pro football to youth sports. Well, thanks to a new mobile app, parents and coaches can test for concussions right along the sidelines. Dr. Rahul Jandial is a neurosurgeon and a scientist. Dr. Jandial, welcome. Thanks for being here.
Pleasure.
Before we talk about the app, explain to me exactly what a concussion is. You know, we hear somebody got his bell rung. It's more serious than that.
Well, let's look inside that person's head. Most of us think the brain sits on the inside of our skull. It actually floats in a clear fluid. So that fluid is like an aquarium, and the brain uses it as a shock absorber. So if you have a small bump, a small from a bike, nothing happens. But now if you have a large impact, the brain sloshes forward and strikes the inside of your skull. But the inside of your skull, unlike the outside of your skull, is not smooth. It's filled with these jagged ridges and valleys. And so you can imagine the delicate brain striking this.
So is it then bruising the brain? Or
it can literally bruise the brain, which is called a contusion, but most of the time it gives you a swelling, and that's a concussion.
Now, as we lead up to the app now, typically on the sidelines, you'll try and, you know, are you seeing double vision? Ask some questions. Pro football, they'll take you into a little clinic behind the stand somewhere. But parents at a youth game don't really have much of an option, or coaches.
I have 3 sons, and we don't have a doctor on the sideline, so parents and coaches have to make that judgment. Has the child had a concussion? Now, if they're knocked out, that's always a concussion.
Sure.
But if they look a little dizzy, is that a concussion or not? This app can help us.
So demonstrate to me this app. This is something that a coach or a parent could use on the sideline.
Right, and it's also other apps, other programs, other things. Now, I'm going to play a role here. Let's go back 25 years and pretend I'm in high school football. It's preseason. Me and all the other players will take a certain test, and we'll have a baseline score.
Right.
Games are on. You might think I have a concussion. You pull me to the sideline and say, hey, take this test. We have a baseline score here of 40 seconds. We start the test. The first one's just a demonstration card, so we'll skip that. And so now I'm asked to read these numbers left to right. The first one's the easiest because we have these horizontal visual cues. So it would be 2, 5, 8, 0, 7, 3, 7, 9. And then we get to the next test, which is a little trickier. Now the lines are not there, so you can imagine if you have double vision or problems with concentration.
This would be easy to do right now, but if I took a big hit to the head, this might be difficult.
Absolutely, and it gets even harder. Let's look at the third test. So you have to have good vision, good concentration, and be able to speak all of the things that help us discern if you've had a concussion.
If a kid can't do that, you're taking him to the hospital.
Well, you're at least stepping them out of the game, and you've made that agreement with them. Listen, son, we let you play, but you agreed we would give you these concussion tests, and you wouldn't ask to be put back in the emotion of the game.
So you at least can get some medical follow-up, and it may not be a big deal, or it may be.
Yeah, and it'll help you with decision-making at the sideline for parents and coaches.
Talk about decision-making right now for parents whose kids are playing youth sports. I mean, what things do we need to know about the risks of head injuries?
Well, sports has tremendous value for our children. I'm a sports fan. It's great for their health. It's great for their socialization. I think parents would only pause at something that would cause a lifelong intellectual or psychological disability. That is the risk with repeat head injuries. And not just repeat head injuries, second hits. So anytime a kid plays sports and you think they have a concussion, please do not put them back in the game and have them see a doctor. I have 3 sons. They all want to play football. We're going to wait till age 14. This is a personal philosophy. The neck will be more robust at that time. They're getting skills in flag football. And then when they do play, we will be at the sideline. They're going to take their hits, but we're not going to let them get that second hit.
And for folks that may be interested, what's the name of that app?
It's a King Devic, but there are a lot of different apps, and the good old-fashioned placards and note cards can be used on the sideline as well.
Same idea, though.
Same idea.
All right. Doctor, thanks very much. Nice to have you here.
Pleasure.
And we'll be back after these messages.